Okay, welcome back. Today we're going to talk about what the heck is in PRP, or platelet-rich plasma. So first off, we draw the blood. So we have whole blood and we spin it down. We take this layer of the blood right on top of the red blood cells that's rich in platelets. We're just going to kind of go through each component of the PRP, what it is, what we think may be helping, what most of us think plays a role in the recovery process when we use this platelet-rich plasma are the platelets. First off, we talk about where the heck these platelets come from. The cells in the blood are created in the bone marrow. So the platelets come from the bone marrow. There's a cell in the bone marrow called a megakaryocyte that creates these platelets. The platelets are like fragments of this cell that are broken off, and then they enter into the bloodstream, and then they float around the bloodstream. So inside the platelets, they have a bunch of different things. We're not going to list them all, but we'll talk about some of them. They have different components called granules. There's different types of granules. There's these alpha granules, delta, there's gamma, there's lambda granules. So lots of different granules of stuff that when the platelet is activated, it releases these things and it creates this response depending on the desired action. So one of the things that we think may be playing more of a role in the recovery process are found in these alpha granules. There's some growth factors in there, like insulin-like growth factor. There's also transforming growth factor B1, platelet-derived growth factor. The delta granules contain other things like ATP, serotonin, calcium, but really some of those growth factors are some of the things that we're more interested in. So that's in the platelets. So when we have the platelet-rich plasma, we're trying to concentrate these platelets. Again, the assumption is something that these platelets are releasing plays a role in this recovery process. But in this fluid of PRP that we have, there's other things. There's not just the PRP. Depending on what we're injecting, sometimes we allow some of the white blood cells to be inside the PRP. So we'll actually take this layer of the white blood cells right on top of the red blood cells and include that in the injection. We call that a leukocyte-rich or white blood cell-rich platelet-rich plasma. Some of the white blood cells include things like neutrophils, basophils, eosinophils, lymphocytes, and monocytes. And there's some opinions out there that it might actually be some of the white blood cells that are actually more important in this recovery process. The monocytes will change into something called a macrophage, and that plays a role in cleaning things up. And then sometimes some of the red blood cells get into the platelet-rich plasma, especially if we're taking the white blood cell. It's like right on top. So whenever we take some of the white blood cells, we pull right into some of the red blood cells. So then you get this PRP, this leukocyte-rich, looks a little pink, a little bit red because of the red blood cells. The red blood cells not playing any active role as far as we know with that recovery process. And then what's left over, whether it's a leukocyte-rich or poor, you still have some of the plasma, so the actual fluid of the blood. So in that of itself, it's loaded with different things. So some of the things that we see in the plasma, you see electrolytes, you see different growth factors, cytokines. One of the treatments we actually do for arthritis is we'll concentrate platelet poor part of the plasma, and we know there's things like interleukin-1 receptor antagonist, which helps shut down some of the inflammation. There's alpha-2 macroglobulin, which also shuts down some of the enzymes that break down the joint. So there's different signals floating around in the blood, in addition to other things like albumin, globulin, fibrinogen. Different clotting factors are in there too. When we obtain the platelet-rich plasma, all these things are inside this. So we're not really quite sure exactly what's doing what. We have some ideas. We think a lot of it comes from the growth factors, sometimes coming from some of the cytokines, as well as maybe the macrophages. It's what we think is playing the role when we use this. So ultimately, depending on how healthy someone is, how healthy their blood is, that may play a role in how well someone does with these PRP injections. So that's a quick overview of what the heck is in some of this PRP. It's more complex than we totally understand, but we use it because we see that it helps if we use it in the proper patient and for the proper problem. Don't forget to subscribe. Until next time.